Hey, George here. Just thought I'd put together a quick video to help you be fully prepared come exam day. So I understand this is one of the biggest exams as a pharmacist that you will do. And you can feel a bit overwhelmed and anxious, nervous towards that exam. So I'm just going to break it down a little bit and give you a few hints and tips to really help you feel confident and keep you on the right path come exam day that you can then smash your exams. So my first big point is you have got this far in your pharmacy career. You have done many exams, GCSEs, A levels, university exams to get this far. You know how you learn, you know how you revise, you know what works best for you. Therefore, let's not reinvent the wheel. Yes, it's a big exam. Yes, it's a different exam. Yes, it's year long. Yes, there's lots to know. But are you a crammer? If you crammed at uni, maybe extend that period of cramming, but don't be put off by other people that have started revising in September, because that's how they work. Know your way of working, give yourself sufficient time, but just know your way. Don't feel overwhelmed. Know that this worked for you previously, therefore there's a high chance it's going to work for you again. Maybe make a few tweaks, maybe reflect on what you did well at uni, you didn't do so well at uni, and really drill down on them. Cool. So know yourself, know it works. So baseline tests. So whether that would be a mock test, a practice paper, online questions, calculations, whatever it is, do them early. Just so then you can understand where your gaps in your knowledge are, where the style of questions that you're going to see, the style of questions that the GPHC are going to ask, how they ask them, what their wording's like. Little things like that really help you come exam day. Also, it helps you with your learning and your revision. Knowing that what to expect, you can then tailor your revision and learning to that. So do a baseline test, do a mock test. I can put some links below for some, for sure. Just do that one off, at least you can then see that, and also allows you to track your progress. Do one, maybe one at 0 months, 1 month, 2 months, see where you're at, maybe a bit shorter, depending on how long you're going to be learning and revising for. Next point, look at the GPHC curriculum. This again, alongside the practice papers, will allow you to understand what is expected of you. What level of knowledge are you expected to know? Because even as a senior pharmacist, we don't know everything. We have certain niches and there's some bits that we're not so strong at. But the GPHC exam is, in a way, a standardizing exam. All the unis coming together, one standard exam to ensure we practice in a safe and effective manner when we are fully qualified on our own. Therefore, it is a general basic knowledge, but more widespread. So knowing what they're going to ask questions on, they'll ask typical topics, typical questions, and different weightings of questions. The more of the cancer drugs aren't really going to be in it. It's going to be more on the respiratory, cardio, infection stuff. There, have a quick look at that. I'll put the link below for that as well. Just have a look at the GPHC curriculum, what they're going to ask you on. Also looking at that curriculum and looking at the practice papers, you rarely see common drugs that come up. Focus more on those. Those are the ones with like the warnings, the narrow therapeutic window medicines, the ones with lots of cancelling points, lots of interactions. They're typical medicines that come up that we see regularly. Therefore, the GPHC want you to know these in a bit more in depth rather than the medicines that we don't see so much or a bit less inert. Give yourself enough time. Yes, I said know your way of learning, but giving yourself enough time will allow you to feel less overwhelmed, less stressed, knowing you're just chipping away. And then you can ramp it up when you come exam day. I wouldn't start flat out now 2-3 months ahead, because by the time you come exam day, you're going to be tired, you're going to be run down, you might not be at your best. So let's try and ramp it up slightly. So the last few weeks, you might go a bit more intense, but giving yourself that time allows you to do it slowly and steadily, not in a rushed manner. That will also allow you to feel a bit more relaxed and take things in a little bit more. Another point being, you are learning every single day. There are so many opportunities to learn, even if you're dispensing or if you're in the community setting and maybe you're in a way just reading the BNF. There's multiple drugs around you, pick them up. What would I counsel a patient on this? What side effects are there? What interactions are there? What would I look out for if I was monitoring their bloods? So many opportunities, take them. When you're coming up, when you're dispensing, when you're cancelling, when you're on the wards, when someone comes in over the counter, make a note of it, have a quick look afterwards. What would you do? What would you tell that patient? Resource packs, key, learn them, learn how to use them, learn a quick process of deciphering that information. So SPCs, drug fact sheets, printouts, where we get that information from. This not only is key in real life, but in the exam, time is of essence, and up to 25% of our questions are based off of resource packs. Therefore, in knowing how to quickly get that information, cipher through where information is in SPCs, will allow us to quickly find that answer. It's a bit of a reading comprehension. Find that answer, put it down, saving time. Time is key in these exams. Yes, they're pressurized, but in you just being familiar with SPCs and other resource pack bits, monographs, printouts, information leaflets, key to saving some time and giving you some more time to really drill down on other questions that you might not be so strong at. Get familiar with these resources is my top tip. Trust the process. The process of pre-reg year, that is. The process that many other pharmacists, including myself, have been through. It works. The whole year is set up structurally to tick off these competencies, which I guess at times can be a bit, why am I writing this down? Why am I have to write out all of this for these evidences, right? But day to day, you're seeing stuff. Subconsciously, you're picking up stuff. Someone might have said something. Some of you might have seen something. You spoke to someone about this. And you will be surprised at how much you are retaining of that information. And that's why your revision and learning is really just pulling that back out of your brain bank and putting it into a structured manner that you can then call upon in an exam. So, like I said to you before, there's many opportunities when we're cancelling, when we're speaking to our seniors, asking those questions. This is your year, and these last few months are really you stepping up into that and putting yourself as a qualified pharmacist ready to deal with those questions yourself. So in knowing that the exam is not there to trip you up, in knowing that it is a basic level of knowledge in a pharmacy world, knowing the curriculum, knowing what's expected of you, having these check-ins with your exams, with your tutor, with your other pre-reg colleagues will allow you to chip away and progress on. I hope that was really helpful for you. So just quickly checking back on everything. So give yourself time. That will allow you to plan your process, to not feel overwhelmed, trust in the process of the pre-reg year, trusting yourself that you've got this far and your exam technique and your revision technique is adequate. Trust that. Don't reinvent the wheel. Don't, if you were suddenly a crammer, switch it back and start revising too early. You're just going to burn yourself out. That's not how you work. Look at non-therapeutic window medicines. Look at common medicines that are in those questions from those baseline and practice papers and mock papers. Common cancelling points medicines, common interacting ones. So the sick faces, crap GPs. Get used to looking at a resource pack information fact sheets. So SPCs, drug fact sheets, monographs, pills, and knowing where things are in those. will allow you to quickly pull that information out. I wish you the best in your revision and your learning. Please reach out if you have any other questions or you'd like me to go through anything else. I hope this video helps you just to really set up your learning, set up your revision, and just trust the process. You've got this. Any other questions, let me know. Take care, and I look forward to hearing from you.